Hello, I'm here with Neil Weir, Senior Vice President of Discovery at UCB, who was part of our funding panel yesterday. Neil, we had a very interesting discussion, but what is, in your opinion, the biggest funding gap we have in biotechnology today, and how do you think we should go about overcoming that funding gap?
So one of the things I think that's struck me from the discussion that we've had over these last 3 days has been, once again, that we continue to need to understand everyone's different perspective. And I suppose one of the perspectives I was hearing loud and clear from young entrepreneurs was a real challenge in accessing funding. On the other hand, I suppose I was attempting to encourage them that my perspective is that there is funding if you've got good ideas. And if you've got clear enough ideas around what benefit that's going to bring to whoever your customer might be, in my particular case we're looking at patients in particular indications, but clarity around why it's going to be different, why it connects to disease. So I think one of the things I took away and was developing was, to what extent can we make sure that we keep all these young people in contact with each other, keep them developing their ideas in a way that actually helps the potential funders gain access to what it really is that's going to be different, and make them much more inclined to fund them and invest in them. And that's actually the theme that's been developing in the team I've been working with. To a degree, what I sense is the biggest gap is understanding how I need to pitch my case, understanding who I need to speak to, understanding what the real gap is. Because I think if you come along, it seems to me we've got to do two things. You've got to marry up a clear unmet need with some neat science. And if you have only one of the two, you don't have something which is fundable. So if you have an unmet need, but you don't actually have a really credible solution, then you're not going to get funding. Equally well, if you've got a fantastic solution to a problem that you've not defined, then you also don't encourage someone. But I think having those two well lined up, and I think that's one of the things that we've all been developing a better understanding of, is what is the unmet need. And even if I don't have all of the solutions, who are the people I can establish relationships or can build my network so that the offering I bring to somebody I would like to help fund looks much more attractive because I brought all the appropriate pieces together.
And you were talking about, of course, you work on helping patients, and we have talked about global health and global health challenges in 2050. What do you think will be the biggest challenges we'll have to solve by 2050 in healthcare and health? And how do you think we should really start working on these problems?
So I think there's two answers to that. I'll give you a relatively general answer and a relatively specific answer. The general answer, I think, is the pharmaceutical industry has to continue to get better at what it delivers for what it invests on behalf of society. And that probably means being more efficient, fewer failures in phase 3. And I think it's easy to say, well, of course we should do that. It's harder to achieve, but I don't think it is by any means impossible to achieve. And I think to do that, we need to understand more about the connection between our scientific hypothesis and the patient that we're attempting to benefit, and the stratification. We had actually some really interesting debates. Not everybody had the same view on what the consequences of stratifying patient populations is, but my perspective is we're going to have to do it because actually most drugs work. But they may work in a very different population, or in some cases a much smaller subpopulation. So a much better understanding of how disease stratifies, a new taxonomy of disease, and targeting and of course part of that is understanding good targets, and the more we can link targets to real human physiology, in some cases perhaps through genetics, then I think the more successful we will be in choosing the right targets, choosing the right molecules, and then very importantly, choosing the right patient subpopulation and the correct readout to ask the question of whether the drug works or not.
Thank you. And
sorry, you asked me, I was going to go on a more specific
one.
Yeah. So I mean, it's an easy and glib thing to say, but the sort of neurodegenerative diseases for which there is fantastic opportunity. Our understanding of science around how the brain works and how neurons respond to the sort of insults that accumulate as you get older is increasing enormously. And that knowledge we have not yet managed to find a way to really apply to drug discovery. Now, there's going to be tremendous challenges because actually further stratification or early diagnosis and treatment perhaps when patients are not yet presenting with symptoms, these are significant challenges, but the magnitude of the potential demand problem to society and for all of us that at some stage may get it, it unquestionably makes it worthwhile because it's supported by terrifically expanding understanding of biology.
So Neil, you've been discussing and chatting with the leaders of tomorrow through the last 3 days, but if you had one key piece of advice to give to these leaders of tomorrow that were both in the room yesterday and the day before, but also globally that couldn't attend the summit, what would be your key piece of advice?
So I'm now going to break the rules and have 2 key pieces of advice. During the discussion, Annalisa Jenkins came up with what I thought was a terrific phrase. She said it's important to get runs on the board. And I think it is very, very important for them to say, you need to knuckle down and deliver something and really achieve something. And you may or may not be able to do that on your own, but very often that will mean that you actually have to do that as part of a group where you actually are working in an environment where you can do something significant. So you have the self-confidence, you have the ability to go and demonstrate to people, I have achieved this, I've made this contribution. And then I suppose the second thing is to maintain the network that they've established here and really work at it. Don't imagine it'll just happen because they met these people. As soon as they go back, think about who are all the people I found interesting and inspiring to speak to, both young future leaders and leaders of the day, and reach out and maintain that network and follow up so that you have the sort of contacts that you can bounce ideas off or ask for advice. Because, all of us know this, but it's very seldom that one person has the great ideas exclusively on their own. They come from synergism of ideas and reaching out to other people. What do they think? How did they see this problem? And I think if they can build on the network that they've formed in these and really actively, because sometimes I think, so there's all sorts of different styles. Some of them will be introverted people and for them it's much harder, but they're probably the people that need to particularly work at it to ensure that they take advantage of the great opportunity they've had to meet lots of similarly minded, energetic, enthusiastic, dynamic people.
So I guess that leads on to my last question. You think there is a need for the GapSummit then in the future as well?
Well, I think it's been terrific. Congratulations to you and your colleagues. It really has been genuinely inspiring to see young people coming together and doing this for themselves. I think there is a need because, I think being successful in this general area requires a combination of fantastic science. You've got to have that. You can't build something generally out of nothing. But it's got to be complemented by some of those other softer skills of relationships and interaction and convincing people, going in and making a pitch to somebody who might be in control of the money, but it's not necessarily have the time to hear all the details. How can you distill that down such that it actually reaches out? So I think that it seems to me that a lot of the people were hugely developing their skills in interacting with other people and listening and taking advice and sharing their ideas and understanding what it takes to actually convince someone and communicate science.
Great. Well, thank you very much, Neil, and thank you very much for taking the time to come to the GapSummit, and I hope you enjoy the rest of your stay.
It's a great pleasure. Thank you very much for inviting me.
Thank you very much.
Okay.